Hi, this is Ellie Fisherman, and welcome to our March 2018 CTisus quiz. I would like to say this is March Madness, but these are good cases. It's not madness. First case is a beautiful example of cinematic rendering, and I asked what the most likely diagnosis of this mandibular lesion is. You can see the expansile lesion, cystic and expansile in the mandible. Well, truthfully, the only lesion I always think about when you talk about mandibular tumors is amelioblastoma, and that, in fact, is the answer. You never, or essentially never, see giant cell tumors. Osteomyelitis would be more of an infiltrating process, and the teeth would look abnormal, and there'd be more of an infiltrating destruction. And a bone cyst would not have these complex cystic components as this is. This is amelioblastoma, beautiful 3D rendering, a very uncommon tumor. The most likely diagnosis in this case, I'm giving you a cinematic and an axial. On the axial, you see a 1 centimeter lesion in the tail of the pancreas. That's vascular. You see the same thing on the cinematic coronal 3D rendering. It's not an IPMN. It's not an adenocarcinoma. And the kidneys look good, so I don't think the patient has renal cell carcinoma. And renal cell to pancreas would be the most common vascular metastasis to pancreas, though not the only one. And this was a beautiful example of a neuroendocrine tumor. I really like this case. This is an interesting case. What's the best diagnosis? You see multiple, mainly sclerotic, but somewhat lytic lesions in bone, spine, T-spine, L-spine, ribs, scapula, everything. What's going on? Well, it could be myeloma, but I guess there is sclerotic myeloma, but mixed sclerotic, lytic, it could be. Breast cancer, usually it's all blastic. Osteoporosis is loss of bone. This is not the pattern of osteoporosis. This is renal osteodystrophy. We always figure renal osteodystrophy. If you look through the shadows here, you really don't see the kidneys. They were really tiny. This is just a beautiful example of infiltration of all the bones. And when you have diffuse infiltration, you got to think about a systemic process. And renal osteodystrophy is a very good systemic process. This is a terrific case and something we're going to see more often with fast scanning. You look at the patient, there's aortic valve replacement, but then there are filling defects. Is that normal? No. Is it flow related? No. Has the aortic valve failed? It may fail at some point, but the filling defects, those low densities, are vegetations on the aortic valve. The patient even has vegetations. You could vaguely see them on the mitral valve, but this is very nicely shown on the aortic valve. Very, very nice example. Good visualization, well seen. This is a classic case, but I don't put this in all the time. If you look at the images, what are we seeing? You see a high-density structure, looks like a stone. You see a dilated appendix, a markedly dilated appendix, classic appendicitis. No ifs, ands, or buts. Right lower quadrant pain. The common things are common. You could think about diverticulitis. There were a few ticks here, but the giant appendix. Sometimes the appendix can be confused with the terminal ileum. Again, the coronals make things very, very easy. In this patient, the most likely cause of the patient's renal and perirenal bleed is which of the following? Well, the good news, I've listed all of the common causes of bleeding. Renal cell carcinoma, angiomyolipoma, trauma, and end-stage renal disease. When you look at the contralateral right kidney, you see the patient has multiple tiny cysts. You look at the left kidney, there are multiple tiny cysts. Patient had no trauma. I don't see angiomyolipomas. I guess theoretically somewhere in there can be a renal cell, but this was a patient with spontaneous bleed due to the patient's end-stage renal disease. Just a very nice example. The most likely diagnosis in this case, I picked this case because we almost never see this. This was something we saw in the era of upper GI series. You look at the esophagus, there's a large cystic structure projected posteriorly. It has some food matter within it. There's a classic appearance of a Zenker's diverticulum. Sometimes this causes aspiration. It can cause mass effect. Just a beautiful example of a Zenker's diverticulum. Now, this case is something that a few people missed, and so I picked this as a case. 30-year-old, trauma, emergency scan. What is that structure in the pelvis? Well, at first glance, you can say, well, maybe it's a tumor or a bleed or maybe it's artifact. Then when you look carefully, you see that's within the uterine cavity. That's actually a fetus. So this patient was about 8 weeks to 10 weeks pregnant. The patient had planned an abortion, so there was not an issue. Again, the radiation dose probably would not have been an issue either. But again, it's something to be aware of. Sometimes we do pick up even patients who say they're not pregnant and they're not having sex and all those things. I don't know how they get pregnant, but they do. It's something that we're very careful about in younger patients when we're getting CT scans in terms of looking at the patient's pregnancy test. But every once in a while, there are false negative pregnancy tests, and this in appearance you should recognize. The key thing is not to misinterpret it as a tumor and then work the patient up for neoplasm. Best diagnosis in this dual energy CT. Some of you, many of you from our courses I know do not do dual energy, so I thought I would show you this case. This is dual energy, 80 and 140 kV, and when you look at the first carpal metacarpal joint and the head of the second metacarpal, and in the carpal bones, you see that green density. That's the pickup on dual energy of uric acid. This patient has gout. Dual energy is really good for detecting gout, and this is just a very nice example of that. The best diagnosis in this patient with hepatitis C, vascular lesion, right lobe of liver, cirrhotic liver, beautifully shown axial and cinematic. At the end of the day, when you have hepatitis C, cirrhosis, and you have a vascular mass, it's not going to be a hemangioma. Regenerating nodules typically are multiple and smaller, and FNHs are vascular, but when you got that hep C, you better be thinking hepatoma, and this was hepatoma. So with that, I've showed you 10 cases. I've showed you a lot of different imaging techniques, from dual energy to virtual imaging to cinematic rendering. I hope you enjoyed the cases. I hope you learned something, and I hope you enjoy March Madness. Catch you later.